All right, and we're live. Good morning, good afternoon, wherever you guys are calling in from today. My name is Kim Kessler. I'm our Director of Customer Engagement here at Redox. And today we have a bit of a unique webinar for us. So it's not going to be some of our standard discussions around really focusing on integration, but we're going to take a different approach and look at the greater digital health ecosystem. And today we've actually got Sidebench on the call with us. And so I'd like to introduce my colleague Ben from Sidebench. So Ben.
Hey everybody, I'm Ben Nguyen, digital health strategist at Sidebench. We're a design and development agency in Southern California, Culver City, if you're around the Los Angeles area. And we focus a lot on healthcare. So glad to be here and looking forward to talking to you all about innovation in the hospital.
Great. And so today we're really going to be diving into that last point Ben mentioned. So innovation within the hospital ecosystem. So really focusing on, development around specific ideas that may be generated from within a health system network, within a hospital network, and really bringing those ideas to fruition and then ultimately integrating them with your platform so that you have a seamless software or digital health ecosystem at your organization. So I'm going to pass things off to Ben and we'll get started.
Cool. So, I just want to quickly touch upon, first of all, who this talk is kind of directed at, right? So, really this could be very useful for any of you who have an idea for a healthcare technology solution. Specifically though, what we want to do is empower frontline healthcare workers. So like the doctors, the nurses, nurse practitioners, PAs, staff in the hospital who are basically on the front line every day facing these problems, and who know of the problem and can think of a solution, but don't know how to get all the way to the point where they can actually deploy a solution in the hospital. Like if you wanted to build an app, how do you do it, right? And also we also want to kind of help healthcare executives and thought leaders in the hospital also think through this process. So that's kind of like who I think this talk would be most useful for. But in reality, this is really helpful for anybody in the healthcare space in the hospital that has an idea that wants to take it all the way to a product launch, right? And specifically, this talk is going to be about how you can build solutions, right, that are going to integrate and plug into an EMR. But there are many, many types of solutions you can build, right? So the things you learn here can be applied even for solutions that you don't integrate into an EMR. But we're going to touch on that because we think that's where a lot of the really important innovations are going to happen, is in solutions that touch electronic health systems, can push and pull patient data from a hospital system. Yeah. So talking about timeline, right? So in this talk, the title is how to get to an actual app in 6 months, right? So just a high level view of the timeline. The bird's eye view is you should expect about 2 months, right? So let's say you are a physician or a nurse in the hospital. You see a problem, you have an idea to solve it. You should expect to take about 2 months kind of socializing that idea and building some internal alliances, internal momentum amongst your colleagues, right? Other nurses, other doctors, thought leaders in the hospital, other executives, and doing all that before you're ready to really go and build something. You should expect about a month for you to kind of do your own research on what's out there, right? And then creating a plan and then finding people who can go in and help you do this. And then you should expect about 3 months for the design and the development and the launch ultimately of an actual tech solution. That's typically a pretty good gauge right now. I mean, the complexity of a solution will definitely change that timeline, but 3 months is usually a pretty good sweet spot in our experience. So let's talk about building internal momentum and alliances, right? And so what you really have to do is, building a tech solution is not easy, right? And it's not easy to get people on your side. So the first thing you really need to do is you identify the need. Now, as healthcare providers, nurses and physicians, you have an intimate knowledge of the need, right? And I think a really common, mistake I see people make if they're in the healthcare field is that, they have this problem that they want to solve, and they can actually think about like a solution to solve it, but they stop themselves from like pursuing it because they say, well, I don't really know tech, right? I don't know how the product development process works. I don't know anything about that. So first of all, that's what this webinar is for, right? But second, I think you should always like make sure not to underestimate the value of understanding the problem, right? What we do here at Sidebench is, a lot of our work is around understanding the problem. So by you understanding the need, that's actually immensely valuable in and of itself. So don't like sell yourself short, right? So when you identify the need to build something to solve, you want to be very specific, right? You don't want to, if you think about something like general patient education and trying to solve that, like that's a good start, right? But they don't go deep enough, right? You want to think about a very, very specific problems and with targets to hit. For example, post heart failure discharge readmission rates, right? That's a very specific problem. There's a metric or two associated. And so if you create something, you can actually move the needle, move a metric, right? And do something that's actually measurable. So patient safety issues, patient experience issues, workflow inefficiencies, those are all nice concrete things that a tech solution is great for solving, okay? So the next part is identifying stakeholders, right? And so, it's not easy to build the internal momentum in a healthcare system in a hospital to do this, and if it was, right, everybody would be doing this. So and that's kind of why it takes some time, right? So it's kind of like building an army. You have to slowly turn people to your side, right? Get them on your side, get them supportive of you, supportive of the idea, and eventually, once you have momentum, you'll be able to make some real change, right? So, we really encourage you to talk to your other colleagues, right? Don't assume that you know everything about the problem or the answer, right? Make sure to get other people's perspectives. You want to talk to the leadership in the department that's affected by the problem. So, if it's post-heart failure readmission rates, right, then you want to talk to the cardiology department. And so, it's important to like get buy-in from the sort of the management and the leaders of these divisions. And then of course you want to get up to the C-level stakeholders as well. Eventually, as we'll kind of talk about this a little bit more later, you are going to need buy-in from high-level executives in order to get a solution through, right? So it's important to like kind of get over to them as soon as you can, right? So like I said, it's like building an army, and socializing an idea takes work, right? So like, think about like, is this something you should be talking about at grand rounds, right? Or morning rounds, if you're a physician and you do rounds, right? Get that idea out there and get support behind it. Now, the other really important stakeholder is the financial stakeholder. This is something that is opaque to a lot of people. It's important that if you want to build something, you also, of course, need to figure out a way to fund that, right? Like you have to pay for a team to build it, whether it's internal or external, right? So every institution's process varies a little bit. Typically, what we find is there's certain tiers of spending. So like below a certain amount, like I believe at LA County, it's 50 to 100. Somebody who is a division head could probably disperse those funds and make a purchase. If it's over a certain amount, like over 100,000, the CEO has to write a specific waiver to fund it. And if it's like at the very high end, like in the millions, then the board might have to vote on it, right? Or there is some sort of sourcing process. It's important for you guys early on, if you're trying to build a solution, to really like figure out this process. Talk to the people, the financial stakeholders at the hospital. The magic words are the procurement process. That's the word that you would use. And if you say that, people will know what you're talking about. You're asking, what's the process for getting something actually bought and funded? And then grants are another good source of funding, of course, as well. If you're in academia, grants are always a good source of funding if you're able to get them, right? You could fund a pilot. Another really frequently asked question that we get a lot is like, how much does it cost to build an app? So the answer to that is that it kind of depends on the complexity of the app. Like a simple one could be, $50,000 if you go with offshore developers, right? It could be pretty affordable, but the issue is that then you would have to manage them, right? So, you would have to be the project manager on that. You would have to have somebody leading the technical team on your side to make sure to vet their work, right? Versus if you went with like a full service firm, which is what we do at Sidebench, it's more expensive. It could be upwards of low six figures, like 100,000, 150,000 to build an app that plugs into the hospital, right? And the reason is because a full service firm does everything for you, and you have to be involved, but they can own the product for you. So that's kind of like the range of budget that you should be thinking of in your head if you want to build something. And I'll hand it off to Tim to talk about the next very critical stakeholder, which is the IT department.
Thanks, Ben. So now once you've got your product or your product idea, you've brought to fruition, you've identified funding for the project that you're looking to dive into, and you have a team ready to go to actually build that. Well, this might not necessarily need to be your first and primary concern, but it's definitely something that you want to start taking into consideration early on in the process, as opposed to leaving it towards the end. And that's, once you have your product ready to go, once you have it complete and developed, how are you going to maintain that? How are you going to implement it? And how are you going to, who are going to be the end users of that application, and what requirements or what needs are they going to have? And that's really where the IT leadership concerns come in. So, when you start talking to the IT team and you start talking with, electronic medical record, your management team, and, the group responsible for actually integrating your product with the core pieces of software in use at your organization, there are going to be a lot of different questions that come up, from, what's that staffing going to look like when we actually want to implement this software solution or this product? What's the staffing going to look like when, once we're already live and we have to maintain that? And that's something that can really differ by, the type of application that you've put together. At Redox, we handle integration, can certainly help with the actual implementation of that application. But there are additional things that need to come into place, such as, what is training going to look like? Are we going to have to train end users on this product, or is it, pretty much plug and play and it's pretty simple to get going and understand? Is there going to be a cost to actually integrate this to our current platforms? What data do we actually need to start passing back and forth from our current systems that we have live? And is there anything that we're going to push back into the new product that we're pushing out, as well as the EHR systems that we already have in place? But the most important part here, and I'm sure many of you are thinking it's going to be cost, but likely the most important piece of this puzzle is going to be that time requirement. So when you start looking at the availability of health system IT teams, the amount of projects that they currently have pending or currently have on their docket, and things that have already been postponed or delayed quite considerably, what you'll find that most IT teams that at health systems are tend to be quite busy with current projects, whether or not that's EHR upgrades or ongoing integrations or just integration maintenance that they're managing for their current platform. So when you approach IT leadership with regards to the actual implementation of your product and the actual setup of your application, keep in mind the amount of time it's going to take to not just implement that product, but also integrating that with existing software systems, understanding what the ongoing maintenance concerns are going to be. Is there going to be upkeep that's required on a weekly, a daily, a monthly basis for a specific product? Or is it something that, once we set up that integration, once we have those feeds passed back and forth, are we good to go? Is there going to need to be, a cutover process during the actual go live where, we have to coordinate different teams and different software teams to actually, turn on the product at the organization to make sure all data between the EHR and the product is correct and up to date with the current status of the health system or the current status of the hospital. One example of this might be if you're putting together an application that deals with patient rounding or requires a patient census, there's going to need to be some considerations regarding the actual cutover process so that you can make sure that when you actually turn your product on, you've got the real-time information around the census and the bed information for that health system, so that you don't have a patient listed in bed 103 in your EHR, but then in your product that you've just turned on live, that patient's not even loaded up, if they're not even listed as being in a bed there. So understanding some of the potential complications that might come with the actual implementation, the amount of time that will be required to actually implement and integrate that product, as well as the process for turning that application on, going live, and ensuring that patient information is correct between that system and your existing system, so that you don't potentially have any patient safety issues when you turn on the application, are going to be critical. And those are going to be a lot of the concerns that IT leadership has when they begin discussing potential product integration for your application. So with that in mind, I'm going to pass it back to Ben, and we'll dive into creating a plan and actually finding the right partner to kick off this process.
Yeah, thanks, Tim. So, it's important when you're creating a plan, right? The first thing you do is scout out the landscape, right? So now you figured out the problem and you have an idea of how to solve it, right? Now it's really important to go outside of the walls of your institution and talk to people in the health tech industry, right? Talk to people like Redox, for example, and look at how have others solved your problem. What other ideas or solutions have you tried? Have they tried that might work for you? Are there any emerging technologies that are kind of just coming out on the horizon that you can leverage, right? Another really important thing that I think people overlook is that people typically, a lot of times I've seen people are like, well, if it was something really big and something important and useful, I would have assumed that our people would know about it in the hospital already, and that's actually not always true. There's a lot of silos in healthcare, and it's very, very important to step outside the walls of your institution, and really kind of go to networking events. You can listen to webinars like this, for example, ask questions, and you would be really amazed how much you'll learn and how many different perspectives there are out there, right? And it seems like common sense, but I definitely still want to encourage everybody to do that. So let's say you've gotten the industry perspective and you figured out that you wanna use an app, for example, that will plug into the EMR, right? Like, what's the next step, right? So the next thing you have to figure out is whether or not you're going to build the technology yourself, or if you're going to buy it, an off-the-shelf solution, right? So, deciding to buy something that's already built versus deciding to build something yourself is not an easy decision, right? And there's pros and cons of each, right? So if you buy something off the shelf, the pros, right? Obviously, you don't need to build it, right? It's already there, right? The vendor that you buy it from is going to maintain it for you. But the drawbacks, though, is that, it might not be exactly what you want, right? Like, it might have too many features and bells and whistles that you don't need, especially if you're just trying to solve one simple problem, or it might not have enough, right? And so, systems and vendors can only customize their off-the-shelf solutions so much, right? Like, they can't do full customizations, right? The other thing is product support might not always be there, right? So products, come and go, right? And so if a company decides to no longer support a product, or God forbid, if the company actually goes under, right, then your IT department and the hospital would be stuck holding the bag if you have a solution that's not supported anymore, right? Somebody has to maintain it. And if that company, that vendor isn't there to do it, then it's going to be tougher on the hospital. Also, you might get locked into contracts, right? They might not be very flexible. Sometimes technologies are built a certain way and they can't integrate with newer systems, right? And so, technology might not be as flexible as you'd like it to be. Building it is also another attractive, decision, right? So if you build a solution yourself, the pros are awesome. You get exactly what you want, right? You have ownership over it. So you as a clinician get a lot of say in how that product is built. It's going to be built to your needs and specifications. Your IT department has ownership over it as well. And they feel like some of it, more of it is in their hands, right? And they get a lot of say over how it's designed and how it's integrated with the system. Um, Product support, as long as you guys, your institution has the resources, or you pay somebody to do it, that support will always be there, right? Since you own the solution. The cons are, of course, that you got to acquire the staff and resources to build the product yourself, right? Um, and you have to manage the building of that product as well, and that involves a lot of staff. I mean, it involves product managers, designers, engineers, and all that. And so you have to kind of be ready to take that on, or hire somebody to take that on, or you pay a company that's full service, which is an external product team, right? And they basically work with you and liaison with you to build it to the specifications that you give, right? And that's kind of what Sidebench does. But it's really important, though, if you do go with the building pathway, and you choose to bring on an external partner, you want to make sure to bring them on early on in the process, because they can help you kind of like avoid a lot of pitfalls of like designing a product and thinking through these solutions. Give you a lot of good guidance like early on, right? Usually because they've done this a lot in the past, and they know how these things go and how to work with internal stakeholders like yourself and other clinicians. So let's say you decide to build it yourself, right? Because if you wanted to just buy it, then the conversation is short. You buy it, and that company works with a company like Redox to integrate with your EMR, right? And you're done. But let's say if you want to build it, right? So this is, I alluded to the process a little bit earlier, but here's just kind of the high level, like, list of things that you have to be thinking about if you want to build something. So like I said earlier, you understand the problem first, right? So you always start with understanding the problem, then you pull together your staff, and this is the process for actually building something. You have to do user research, you have to do user interviews, create user stories for development. You get designers, you need to create wireframes and mock-ups and figure out the flow of the product. You got to roadmap the product out. You need to architect a product, right? And then you have to have somebody actually build the code, right, and write the code, and that's the development. And then you also have to think about testing as well, because you always have to test before you release a product. And then ultimately, after you release, you have to think about having the staff to maintain and upgrade it as well. So if you want to lead an internal team, these are the things that you have to keep in mind, that you have to be ready to do this, right? And we have seen people do this successfully before, if they have the resources, but it does take a lot of dedication, right? And so it's definitely not easy. And so let's see. So if you do choose to do this internally, that's amazing, and that's a great thing for you to do. If you choose to build it, but you choose to hire an external product team, then I can tell you also a little bit about what that's like, to hire an external product team, right? So so just remember to loop in the external product team really early, right? And then what you can really expect from a good product team. So if you go out and you're talking to teams that can build this for you, you want to make sure these are the signs of a good product team, that you should always keep in mind when you're talking to people, right? So they should fully understand the problem you're trying to solve. They should be able to articulate that problem. They should be able to articulate the value proposition that you have, and the vision that you have to other people as well, right? Because they're going to have to lead their teams internally to build this for you. So, whoever you're interfacing with really needs to have a strong grasp of that, of your vision. They should be able to guide you through the development process, even if you're new to it, even if you're a non-technical person. Which tends to be the case, right? I mean, people who hire out external product teams are people who are usually leaders in the industry, thought leaders in the hospital. They're frontline workers, but their life and they have been really dedicated to like taking care of patients, right? And so if they don't have as much experience with external product development, like a good product team has to be able to lead them through that process, right? They should be able to guide you very, very well on the product roadmap, figuring out what features to build in, how to prioritize, right? They should always be keeping tabs on budget as well. That's another very good sign of a product team is they're like, okay, you have this amount of money, this many hours we can spend, and we are going to stay within that. That's a very, it's a good sign if a team, talks about that all the time and keeps tabs on it. Checks in with you and all stakeholders. That's really important, making sure everybody's happy, everybody gets a little bit of input, right? And also like a really strong focus on milestones, right? And guiding you and guiding the whole team towards milestones. Those are always very important. Yeah, so those are the things you want to think about if you're going to hire outside teams, right? To make sure that you vet them, make sure that they are the right fit for you. So now that, let's say you've done all that, you've hired the external product team, what's next, right? Well, next is going to be, implementation and launch of the actual product. So I'll hand it off to Tim to talk about that process, which is definitely going to involve a little bit of work with Redox now.
Thanks, Ben. And so now for a lot of all that fun stuff that I alluded to earlier when we start talking about when the IT team comes into play. And so you might be thinking about, if your product's pretty simple and requires very minimal input from an existing data sources at a health system, maybe this is a rounding application that most of the information can be entered in manually by a physician or doesn't require some integration, then a lot of this might be simplified when it comes to the implementation and launch. But what we're seeing more and more of in the digital health ecosystem today and at health systems, hospitals, and physician practices across the country is we now have 95% of physicians that are documenting electronically into an electronic medical record or a practice management system. And so what that means is these EMRs are now the primary data source for all patient information at a health system. And not just patient information, there's quite a bit of administrative information, inventory information, really anything that you can think of that might need to be documented in a health system is almost certainly being documented, in a software system, or more specifically, an electronic medical record or an EMR. And with many of the digital health solutions we see today, it's really important to be able to tap into that information, integrate with it, both pull it out of that system and push new updated information back into the EHR. And so that's where Redox comes in. So when we start looking at implementations, specifically around integrations, what the industry is going to be very familiar with, and what a lot of the health systems and IT teams that you work with will be very familiar with, are what we call point-to-point connections. So that is where you build an individual connection from an application directly to an EHR, or from an EHR directly to another EHR. And these can be very time-consuming processes, requiring anywhere from months for the implementation, with upwards of 50 hours of IT team resources necessary, handling things from, configuring specifications and crosswalks for data feeds so that, incoming data from one system is going to map and file to the appropriate location in another system. But when you start throwing out numbers like 6 to 9 months or 50 hours of IT team resources, that becomes a significant commitment on the health system's IT team. And in many cases, these IT teams are already very busy, managing the existing applications that they have. I mentioned EHRs and practice management system, but when you actually look at most health systems and most large hospitals, they could have hundreds of applications and systems that are up and running simultaneously, all passing data back and forth between each other. So it's not just the EHR, and it's not just a couple systems here. There are going to be a massive number of tools and products in use at these organizations. So when it comes to planning for that implementation, it's important to have a good understanding for what that time is going to require and what the effort level is going to be on that health system's IT team. And that's where Redox can come in and help simplify that process. So much like Ben was referring to when discussing about deciding between building versus buying a solution for your product team and your product development team, much the same will apply when you're actually looking at that integration. So when you're looking at building out a point-to-point connection, you're looking at significant time investments and significant resource needs from a health systems IT team. Whereas, working with Redox, we can simplify much of that process. So we've built an extensive API that allows us to work closely with applications and connect them once to our API, and then we can reuse that connection across all the health systems you guys might be selling or commercializing that product for, But even more specifically, we can leverage that API to move very quickly internally. So we can do away with, a lot of the difficulties with connecting to HL7 and X12 feeds, and really pull a lot of that work effort off of your health systems IT team and onto the Redox team to help simplify that process. So I've thrown out a couple numbers here for what a typical integration project looks like with Redox, and we brought that 6 to 9 month integration down to about 4 to 8 weeks for that first implementation. And we can certainly move a bit quicker in many cases, but there are going to be a lot of steps that we have to account for, and in some cases we can't do away with several of these. And even more importantly, during that, while we've condensed the overall time of the implementation, we've significantly reduced the amount of hours required from a health system IT team. So, if a typical point-to-point connection might require roughly, 50 or more hours of IT team resources for a lot of those different tasks that I mentioned, integrating with Redox is going to pull a lot of that load off of the health systems IT team, to the point that we've gotten the total number of IT team hours down to about 8 to 12 per implementation. And a lot of this is because during an implementation, you're going to have a dedicated project lead from Redox who's going to handle a significant amount of those really time-consuming tasks, like mapping those interface feeds to a standard structure so that we can ensure that data flows appropriately. So when we start looking at what an implementation is going to look like, we're going to start off with that phase one, building out the connectivity between your application and the Redox API, as well as the Redox API and the health systems interface layer. Once we have that connection, that VPN set up and that data flow active, then we're going to begin configuring the health systems interface feeds to our API so that they're mapped to that consistent JSON structure that we use. Now, if you're only building a direct connection to the health system that you're working with, you technically could map up directly to their HL7, X12, Fire, or web service feeds that they're using, but it's a much more difficult process than connecting to a JSON API. And as I'm sure many of you are aware of, it can be much more difficult to find developers and programmers who are familiar or comfortable with working with HL7, X12, Fire, or some of these unique health system interface languages, which is why leveraging our JSON API can help speed up the process significantly, as it's going to be much easier to find resources that can actually build out these connections. Next, we'll get into the testing phase. And this is really going to be one of the critical phases of the project, because it can certainly expand or shrink depending on your application and what sort of data needs you guys have. Whether or not you're pushing data in or just pulling data out of the EHR can have a big impact on the overall testing timeline. So when we actually enter into that testing phase, we'll complete both functional and end-to-end testing, and include end-user testing if necessary. But it's going to be important that we have enough testing scripts and enough testing scenarios that we can ensure that, in any potential scenario, we know that information is flowing appropriately and filing to the right locations within the destination system. So once we've completed testing, we've ensured everything's flowing correctly, then we'll begin that go live process. So this will generally be, over a full day period, where we'll start off in the morning with a soft go live, where we'll migrate configurations to production, turn on interface feeds, and actually confirm that data is flowing appropriately. Once we've confirmed that everything's working as expected, then we can actually, move to that full production level go live, where we, issue a notification to end users that the product is active, the application's active, and it's ready to be used by end users in that hospital setting. During that time, Redox will, of course, provide support to troubleshoot issues that may arise, help identify potential concerns, or understanding message volume and what that's going to mean for your organization. So overall, the process will be very lightweight for both the health system IT team as well as the product team that's actually integrating this. And that's because when working with Redox, we're gonna abstract a lot of the difficulty and the things that make integration difficult and tough and frustrating, and pull that onto the Redox team and leverage the power of our API to help speed up these processes and really simplify the integration for you.
Right. So, after you've done the integration and you're ready to go live, right, then the last thing you have to think about is launching the pilot, right? And So this I'm going to touch on kind of briefly because this talk is more focused on the process of getting to the pilot. But you should always be thinking ahead. And so if you have a product ready and it's going to go live and you've done the Redox integrations, beforehand, you have to think about making sure that you have the department heads, the nurses, the doctors, other end users, you have them on the same page, right? And you've created a launch plan, right? You've worked with the respective managers of those departments, you've secured resources and time, and you've set your expectations about, what launching this product will be like, right? You figured out the budget and the time that you need to do a pilot launch, right? So think about the time that you need to spend on preparing and training people to use this product, right? And also thinking about, what it means, like how many people you want in a small launch, right? Where in a hospital would you test this first? Which small departments, who gets to try it out first, and how do you, set up boundaries for how they try and use the product? Do a larger rollout or a go live, right? And then of course, figuring out how you test how people are using it, right? How do you capture data about who's using it and how they're using it, right? What they like, what they don't like, right? Do you need to set up debriefings, right? Do you need to set up meetings and focus groups, right? So thinking about all those things are very important to make sure that your product launch is very successful and sustainable in the long run. And yeah, so that kind of encompasses the entire process from start to finish. And I'll hand it off to Tim.
Great, thanks, Ben. Great, so now Ben and I will have, we're happy to stay on line for quite a bit longer and answer any questions that you guys have. So I know Charlie's posted something real quick in the sidebar to the right, so feel free to drop any questions that you might have, either in the sidebar where it says, I think it should say something nice there, or there's also an ask a question button that you should see right below the video, where you can actually select that, ask a question, and then we'll answer that for you. So it doesn't look like we have any questions in here just yet, so we'll stay on line for a couple minutes though, and in the meantime, feel free to post any questions that you might have or drop any comments that you have in the sidebar. But in the meantime, I do have a quick question for Ben. So, Ben, I know Sidebench has done quite a bit in the healthcare space. I was wondering if there are any, projects or any areas of focus that you guys have done quite a bit of work in within, from the healthcare perspective, that you might, be able to share with the group or the audience here while we wait for a couple questions to drop in.
Yeah. So, I mean, we've done quite a bit in the healthcare space, both in kind of the payer space as well as kind of the consumer space. One of the projects we're most proud of right now is the work we did with Inland Empire Health. They're a very large managed care plan out in Riverside, San Bernardino County. They nearly doubled in size to about 1.3 million members after the Medicaid expansion hit California. And what they really needed was a way to manage all those members, right? And so we came in and we worked very closely with them to build out member management portals, mobile apps. We built their Smart Care app, and that kind of enabled them to, to really push out information to their members. Cut down the time that they needed to do phone calls. Right, it allowed their members to look up their insurance plans, pick out their physicians, et cetera. And that was work that we were really proud of. We're adding more stuff now. We're adding patient education tools, using content from the American Heart Association now to their app. And so that was a lot of fun. Yeah, I think we have a question.
Yeah, let's take a look at this. So if I can find my mouse here. All right, so question from Robert. Robert, looks like you're out in LA too. Apologize for some of the traffic you might have run into this morning. I know Ben and I were joking about that earlier, but looks like you're out in LA too. And if you are in the area, either LA for Sidebench or Madison or really just the Midwest in general for Redox, feel free to reach out. We're always happy to meet with groups and kind of understand some of the problems that you guys are facing in the industry, some of the difficulty that you might have overcoming some of the barriers to entry when, implementing a digital health app or, really getting the ball rolling in a health system. And we would be, more than happy to talk with you guys and really dive into some of those, the problems that you're seeing and the solutions that you guys are looking to implement to actually solve them. So Charlie's posted both my and Ben's email in the sidebar. So I'm just tim@redoxengine.com and Ben is ben@sidebench.com. So pretty easy emails right there, but feel free to shoot us an email if you guys have any questions, or if you want to set up a quick chat to dive into some more details around a specific project that you might be working on.
Yeah, Robert, happy to talk with you offline about your needs there. So
great. So looks like we're a little light on questions today. As always, though, feel free to reach out via email. We're happy to answer any questions that you guys might have. Or if you're just curious about learning a bit more about our companies, I'd encourage you to check out our websites. We're at redoxengine.com and Sidebench is sidebench.com. So nothing crazy there. And if you do have any requests for any sort of documentation, any materials, or you'd like to see some of the work that we've done in the past, feel free to reach out and we'd be happy to provide some of that information. Well, with that said, thank you everyone for joining us. We really appreciate you joining on the call or joining on the webinar. And we hope to host quite a bit more of these in the future. So, keep an eye out for some more interesting topics that you might be interested in. Or, if you do have any topics that you'd like to see us cover, feel free to reach out and we can look to put together a webinar on those.
awesome. Thanks, everybody.
Thanks, guys. Take care.